If you want knees that actually let you walk, climb stairs, and move without that deep, sharp, constant ache, but everything you try only gives you temporary relief. Injections wear off way too fast. Every doctor keeps telling you that you're just getting older. Here's the real reason. Your knees, they still have not healed. You have been treating the pain, but no one has treated the mechanics that cause the pain. In this video, you'll see why most chronic knee pain never improves with traditional care and why treating the symptoms instead of the mechanics keep people stuck in that same painful loop. You'll also learn how our 9-step Walk Strong protocol restores the actual function of the knee rather than masking pain on the surface. You will also see how hundreds of patients have finally gotten relief in improving their knee pain once they followed this system, and how we measure real progress instead of guessing. Just like Mark did, who loved walking, golfing, and going to CrossFit, but felt his knees were holding him back. When it came to us, he could barely stay active without any pain. After following the Walk Strong protocol, one knee improved by 60% in just 3 months, and both knees reached an 80% recovery by month number 6. Now he's back going to the gym, he's back walking, back to playing golf, back to living without that constant irritation and knee pain. And don't forget to stay to the very end to discover the factor that kept Mark and many like him from making real progress. The one simple exercise we added that finally let his knees calm down and start healing the right way. Hi, I'm Dr. Chris Cameron, a chiropractor here in Lucan, Ontario. I help people with degenerative conditions like back pain, knee pain, disc bulges, disc herniations, and sciatica overcome their pain, improve their health, and get back to doing the things they love, all through safe, non-surgical corrective methods. On this channel, you'll find practical tips and insights on managing back and neck pain, healing disc injuries, and improving overall spinal health. Before we dive in, make sure to subscribe so you don't miss any of the new videos on how to strengthen your spine, enhance your well-being, and live a more active, fulfilling life. I upload a new video each and every week. Most people never realize that the traditional knee care focuses almost entirely on managing symptoms instead of correcting the mechanics that caused the problem in the first place. That is why you might feel better for a few days after an injection or another prescription, but the pain keeps returning. If the joint is still compressed, if the muscles are still firing unevenly, and if the alignment in your hips or feet is still off, the inflammation in the knees has no chance to settle down. This is why so many patients feel stuck, even when they are doing everything they're told. And this is exactly where a different approach becomes necessary, because real improvements only happen when you fix all the factors that keep the knee irritated. Let me show you how we do that with the Walk Strong protocol. A lot of treatments focus on calming discomfort instead of correcting what is actually going wrong inside the joint. You might feel temporary relief, but nothing changes in how the knee moves and how the joint absorbs pressure. When the joint stays compressed, when the muscles fire unevenly, and when alignment remains off, the irritation always returns. That's why so many people feel they're doing everything right, but still not improving. Now, let me show you the Walk Strong protocol changes that. The Walk Strong protocol is our 9-step non-surgical system designed to fix the mechanics that keep the knee irritated. It's not about doing more, it's about doing the right things in the right sequence. This is why patients who felt stuck for years finally start seeing measurable progress once everything begins working together. Let me walk you through each step. Shockwave therapy is where we begin, because most chronic knees are still loaded with scar tissue that keeps the joint stiff and inflamed. When the tissue is glued, the knees cannot glide properly. Shockwave breaks up these restrictions and stimulates your body's natural repair process. This removes the physical barriers that have been blocking your progress for years. Once the scar tissue is released, the joint needs space. Chronic knees are compressed from years of overload. Decompression gently opens the joint so nutrients can reach the damaged tissue. This is often where patients feel real relief for the first time. Next, we use robotic laser to accelerate tissue repair by improving circulation and reducing inflammation. It turns the body's natural healing response back on. Neuromuscular reconnection. This step rebalances the muscles surrounding the knee. We lengthen tight muscles and activate weak ones. This creates true stability and coordinated movement. We correct the hips, knees, and feet so pressure is no longer misdirected into the joints. This reduces torque and overload with each step. Step 6, custom orthotics. Orthotics support proper alignment from the ground up, preventing the knees from being pulled out of position. Walking becomes smoother, more natural, and less painful. Step 7, the deload brace. This gives the knee controlled rest while keeping you mobile. This is often the first time patients feel genuine relief. Step 8, targeted supplements. We support the cartilage and the joint repair from the inside out using key nutrients that reduce inflammation and improve lubrication. Step 9, home-based rehab. This final step reinforces lasting progress with simple exercises that protect the knee long term. This is how patients not only feel better, but stay better. The biggest mistake that most people make is their knee never gets real rest. Even normal walking can put too much pressure on a chronically sore knee. So we introduce simple movements to relieve the joint without limiting your life. For example, the tailgate swing, a simple but effective exercise. Sit comfortably and let your legs hang freely, gently swing them back and forth. No force, no strain, just movement. This increases circulation without adding unnecessary load to the knees. Accumulate about 60 minutes per day in total. Simple, safe, powerful. Chronic knee pain isn't fixed by masking symptoms. It heals when you correct the faulty mechanics. That is exactly what the Walk Strong protocol is designed to do. If you found this valuable, then go ahead and like and share it so more people understand they don't have to live with chronic knee pain. And if you're in the Lucan, Ontario area and want to see if the Walk Strong protocol is right for you, give the office a call for a consultation, 519-227-1363. And if climbing stairs is one of your biggest struggles, your next video is how to reduce knee pain when climbing stairs. Right above. Click the link.